McLaughlin Wellness Clinic, your first step to better health.
Hello, I'm Dr. Cole at the McLaughlin Wellness Clinic. Today I'm going to talk about abdominal bracing and why it's important. And the main reason why it is because almost every time I see a patient here for low back pain, or if I get a new patient visit, I'll almost always show this exercise. So it's one of my main ones that I'll use. And it's a very good exercise if you see my previous videos that this is one to add to the arsenal because it uses the neutral spine and it makes you some of the same positionings. What do I normally see in clinic is what I'll see is a low back sprain or strain with this. So the kind of injury where you may tie your shoe or you may pull a sock on or reach down to pick up your kid's toys and then you get a bit of a jolt or pull in the low back. That's typically what this exercise will really help with because it is so common. Typically it takes 2 to 4 weeks for you to heal on your own, and sometimes it can take longer because you may be further irritating that same tissue in your low back. If you keep irritating it, it's going to take you longer to get better. My analogy I usually use is like when you get a scab on your arm. If you get a scab on your arm and you keep picking that scab, it's going to take you longer to heal. Right? If it scabs up, you pick it, starts to bleed again, then you pick it again after it's healed, and then it's going to take longer, and more scar tissue is going to build up. So naturally, that scab is going to scar and it takes longer. Same with low back pain. If you say you got a back pain, say 2 weeks ago, and it's still bothering you 2 or 3 weeks further, you probably are still further irritating that same tissue. So with exercise, what we try to do is cover that scab up. Make sure the back's not getting that jolt of discomfort as you bend over to pick something up, because again, you're going to heal a lot faster. And with my treatment, I find I can get people better in with a week or 2 weeks with low back strains. Pretty good, especially when you use this exercise. So before I start showing the exercise, there's a few things positionally that I want to show you. And one is anterior and posterior pelvic tilt. So when your back gets a bit of a hyper arch here, that's called your anterior pelvic tilt. And when you kind of flatten your back, you get a posterior pelvic tilt, okay? So again, anterior pelvic tilt, posterior pelvic tilt, okay? And so with this exercise, you're going to lay on your back. So this is the position you're going to lay. And with abdominal bracing, imagine someone's going to punch you in the belly. You want to tense up your core, okay? And you'll see even there, as I tense up my belly muscles, you'll see that my back almost flattens here. It forces my hips into that posterior pelvic tilt, just slightly, okay? You want to definitely avoid anterior pelvic tilt because that's going to create more irritation in your low back and give you more discomfort, okay? So here's the exercise. I'm going to demonstrate or talk as I do it here. So core engaged, make sure your hands on your belly to feel that it's engaged. As you feel comfortable engaged, your back is flat, then bring your leg up 90 degrees and 90 degrees here. Once that's up there and you feel good, bring the left leg up. Okay, and then we're going to do 5 each side. So right's going to come down and then back up. Left's going to go back down and come back up. And you do that 5 times each side. What you want to avoid is when my leg comes down, don't let your back arch and your core disengage. So you don't want to do this. You want to keep your pelvis the same height and your core still engaged, and it almost looks like just my hip and knee is moving here. Okay? And you also want to prevent, when you go to disengage this, you don't want to drop out of it. Okay? I disengaged my core first, then my legs came down. You are going to feel a bit of jolt in your low back when you do the exercise. So if you do it this way, core engaged, back flat, legs up, and you're going to come down, you want to do one leg at a time. So you do your exercise, 1, 2, and 2. Once you've done 5 each, bring the right leg down first, then the left leg, then disengage your core. And then you've completed the exercise, okay? This is an exercise that is difficult. It works your mind-body connection to know how to engage your core. You may find it very difficult if you're not an athlete or if you haven't done it before. So if you have questions or concerns or you want to learn more about it, please book an appointment with myself at the McLaughlin Wellness Clinic. Our phone number is 519-676-3311.
McLaughlin Wellness Clinic, your first step to better health.
Whether it's neck, back, or other body pain, don't let illness or injury get in the way of living your best life. Discover the difference at McLaughlin Wellness Clinic. Many treatment options in one location means the McLaughlin team of specialists work together to find you the best solution.
The right place, the right care right now.